It's advisable to visit a dentist at least twice yearly, every 6 months. Now, it's important because the dentist can detect a number of conditions before they become full blown or they start incapacitating the individual. For example, a visit to the dentist will help the dentist check for either cavities, that is, holes in the teeth, bleeding gums, redness of the gum, or even swellings. Sometimes other conditions like even oral cancer, can be detected quite early. Now, don't forget, prevention is not only better than cure, it's also cheaper than cure. Don't tell yourself that you are okay. You do not have a need to see a dentist or have a dentist treat you in the past 30 years. So you are all clear. No, 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 no. People do that a lot. So go to the dentist, it may surprise you that something can be found. But the beauty of it is this: if the dentist detects anything early, the sure is going to be cheaper and then it's also time saving. So don't forget, twice yearly. If you have cavities already, then you must do that more than twice yearly, because the sign of one or two cavities means you have a high tendency for cavities. So you need to do that like 3 times yearly. That's every 4 months. That is if you have a problem already, or in the past you've seen the dentist and you have tooth cavities. Fantastic. Cosmetic dentistry is a very broad area of dentistry. It has to do with improving your smile, getting a smile that opens doors. People want clean, white teeth that are straight, not teeth that are crowded together or overlapping or crooked. So cosmetic dentistry today has advanced so much that you can, if you have discolored teeth or you don't like the color of the shade of white, precisely, you can improve the shade, by several steps. Tooth whitening today is commonly done, and we can have even, you can upgrade your shade of white to even 12 steps. Now, where tooth whitening can solve the problem, there are veneers, different types of veneers. Veneers are just coverings on the teeth, just as we place artificial nails on our fingernails. We can also place veneers. They are coverings or facings that we can place or glue to the teeth. They will help us correct the shape if the shape are not classic or normal, and they can also improve the shade of white. If you want to have sparkling white or snow white color, you can have it. Veneers can come as composite veneers. There are veneers that are ceramic veneers. So they have different composite. I mean, there are veneers of different quality and types. So when you ask your cosmetic dentist today, they can help you with this with more information. And every day, science keeps bringing in, turning new ways of doing this. Sometimes we even use lasers, right? So cosmetic dentistry can improve your smile significantly. Today I see different people, for example, applying or carrying out tooth whitening procedures. Most of them are not qualified, they don't have the training. They use very harsh chemicals that can excoriate the gums and even cause serious tooth sensitivity. Tooth whitening should not be done by unqualified personnel. The dentist is licensed to do tooth whitening. You can just do it by down the road or just in the street. So you see someone says, "I can do tooth whitening." Sometimes it's done in hairdressing salons and spas. And so I can tell you, in untrained hands, you can have serious hypersensitivity or the excoriation of your gums. Now, tooth whitening, if you have tooth whitening, you need to avoid certain habits like smoking, or taking some, like a lot of chocolates, because this can easily reverse the whitening. Except you do very expensive ones that has to do with veneers, especially ceramic veneers. With that, you may not suffer this uh, situation. Another thing is this: you have veneers on your teeth, for example. You're not supposed to eat hard food or cut hard food with the front teeth because this can break the veneers. When you have veneers that are placed after the teeth are shaped, you may not have your teeth back as they used to be because any shaping of the teeth it's irreversible, but the dentist can still build the missing parts. That's the beauty of it. So today, so many possibilities are there. So if you want to whiten your teeth, if you want to improve your smile, just go for it. It will make you more self-confident and it will open more doors to you. Okay, preventive dentistry is that aspect of dentistry that has to do with prevention of dental disease. And in this area, dental education is a key part of it, where the public is taught about the ways one can prevent tooth cavities, gum disease, and so on. And in dental education, you preach prevention, you preach nutrition, you preach dieting, the right diet, and then a lot of home measures like toothbrushing, dental flossing, and all these are activities that can be carried out by the individual to prevent dental disease. While restorative dentistry has to do with restoring damaged teeth, using it has to do with the production of fake teeth, and those fake teeth can restore the tooth structures that are lost either to tooth wear or to fracture or to even tooth loss. When the whole tooth is missing, if you have extracted a number of teeth, a dentist can replace those missing teeth with fake teeth. So, in short, restorative dentistry has to do with using fake teeth to replace either damaged or missing teeth. So that's the marked difference. That although restorative dentistry can also do a bit of preventive, because sometimes when you have a patient who has, or an individual who has a tendency for having holes in their teeth, in restorative dentistry we can apply some like filling, and that filling will prevent further damage of that tooth. So you can see the bits interwoven. However, there are two distinct aspects of dentistry. All right. Yes, if an individual presents with an aching tooth and the pain from the tooth disturbs sleep, and when the tooth is percussed or knocked, and the individual feels tremendous pain, that kind of pain that lingers and wakes one up from sleep, then it means the infection or the damage has gone to the heart of the tooth or to the part of the tooth we call the pulp. In that situation, that tooth may have to be extracted. But in this day and age, the technology for fixing teeth that should be extracted has so grown that we can save teeth that should be extracted. So, and an intervention called root canal therapy or root canal treatment can be applied in saving a tooth that should be extracted. Now, we have 32 teeth in our mouth, but if the last teeth, the molars, we call them the wisdom teeth, the last four, once they are bad and the pain from them strubbing, we typically extract them. There is no need to keep them in the mouth because today, civilized man living on civilized food or modern food do not need 32 teeth to chew well. Just 28 is good enough. So a dentist makes the decision to save a tooth if that tooth is redeemable, if it's savable through root canal treatment as against extracting the teeth. So if an individual has a bad tooth that is aching, throbbing, disturbing sleep, and if finds him or herself in an environment where root canal treatment can be done, I advise they should go for root canal treatment to save the tooth rather than extract the tooth. Extraction of teeth that can be saved should only be done in resource limited settings, perhaps in rural environments where they don't have the technology or expertise to save a very badly damaged tooth. The most effective methods in preventing tooth decay or tooth cavity in any individual, whether children or adults, first of all, nutrition. Good nutrition means whatever you eat should go into your system and help in making your teeth resistant to decay. Foods containing calcium like yogurt, like soft fish bone, like even tea containing fluoride, even small soft fish bone contains fluoride also, and then oily fish. All this food contains calcium and phosphorus and leafy vegetables. This will help as you take this food, they go into your system and then they release calcium, phosphates, and fluorides to the teeth, making the teeth resistant to decay. That's one level. The second level is your diet. When you eat fibrous diet contains a lot of fiber that are spongy, like pineapple, like apple, oranges, green leafy vegetables. They act as a natural toothbrush. They are spongy, so we call them cleansing foods. They tend to cleanse the teeth as you chew them because they are crunchy. Cucumber, just imagine you're biting on cucumber or carrots. Wow, that's a natural toothbrush. It'll clean all the dental plaque from the surface of the teeth. So that's another level. So apart from nutrition, diet, and then a number of home care measures. These are habits you have to develop. You have to develop to help you prevent tooth decay, like toothbrushing. Brush twice daily, at least for 2 minutes. 2 minutes. Don't just rush in and rush out. Use a nylon textured, bristle toothbrush with a small head so that it can reach most inaccessible areas of the teeth. Now, and don't let your toothbrush flake. After 2 months, discard your toothbrush and get a new one, because at the end of 2 months or at about 2 months, the bristles should be flaying or they'll be weak and won't be effective anymore. So when you brush your teeth in the morning, especially after breakfast, you also brush as the last thing you do before going to bed at night. Then you use dental floss. Dental floss is that string that you can use in cleaning the junctions between your teeth, because those are areas your toothbrush bristles wouldn't get to remove the sticky food particles that causes gum disease and tooth decay. So floss at least twice daily. Okay, and then it's also important to use a mouthwash. A mouthwash that contains chlorhexidine or thymol will kill bacteria that causes tooth decay. So mouthwashes are very, very important. They also give you fresh breath. So when you make this habitual or routine, you are going to prevent tooth decay. And then children should be assisted to brush their teeth. They should not, don't just supervise them, assist them to do it, except they agree to do it and do it very well, right? And it's very, very important in children. Despite doing all this, you still have to visit the dentist at least every 6 months, twice yearly, to have a professional intervention we call scaling and polishing. The dentist has very special instruments, that can get to different corners of your teeth where your toothbrush, your dental floss cannot reach. So the dentist can clean these corners and crevices or hidden parts of your teeth, taking out dental plaque which causes tooth decay. So that is very, very important, despite all these other measures that you must have put in place or you must have been carrying out. So with that, you can cheat your dentist, right? Yes, you want to keep the dentist in business, then neglect all the things I've just told you, and your dentist will become richer.